HHA Practice Test 2026 Home Health Aide, Full Course Occupied Bed Making Guide. Question 1. What is an occupied bed? A bed with no one in it. A bed with a client in it. A bed that is being repaired. A bed in a hospital. An occupied bed is one where the client remains in the bed while it is made. Question 2. What is the most important safety consideration when making an occupied bed? Using the right color sheets. Keeping the side rail up on the side away from you. Making sure the pillows are soft. Finishing quickly. The side rail on the opposite side must be up to prevent the client from falling out. Question 3. Why should you never shake linens? It's noisy. It spreads microorganisms into the air. It causes wrinkles. It makes the client dizzy. Shaking spreads germs and dust. Question 4. When removing soiled linens, how should they be handled? Roll them away from your body with the dirty side inside. Carry them against your uniform. Throw them on the floor. Shake them out first. Roll dirty side in and keep away from your uniform to prevent contamination. Question 5. What is the purpose of a draw sheet? To decorate the bed. To help move and protect the client. To keep the client warm. To cover the pillow. Draw sheets are used for positioning and protecting the bottom sheet. Question 6. Where should soiled linens be placed immediately after removal? On the bedside table. In a leak-proof biohazard bag or hamper. On the floor. On the chair. Always place soiled linens directly into a hamper or bag. Question 7. In what order do you usually make an occupied bed? One side at a time. Bottom to top. Head to foot. All at once. You complete one side of the bed before moving to the other. Question 8. What should you do before starting to make the bed? Explain the procedure and provide privacy. Open all the windows. Turn the TV volume up. Take the client's blood pressure. Communication and privacy are standard care steps. Question 9. When a client is rolled to one side, where do you place the clean bottom sheet? On the floor. Tucked under the soiled sheet against the client's back. On the bedside table. Over the top of the client. The clean sheet is tucked under the dirty one to be pulled through later. Question 10. What is a toe pleat used for? To keep the client's feet warm. To prevent pressure on the client's toes. To make the bed look neat. To keep the sheet from falling off. Toe pleats prevent the weight of the covers from causing foot drop or discomfort. Question 11. How do you ensure the bed is wrinkle-free? By ironing it while the client is in it. By pulling the sheets tight and tucking them securely. By using silk sheets. You don't need to worry about wrinkles. Wrinkles cause pressure and skin irritation. Question 12. What should you do if you realize you brought too many clean linens into the room? Put them back in the clean linen closet. Place them in the dirty laundry. Give them to another client. Keep them for tomorrow. Once linens enter a client's room, they are considered contaminated and cannot return to the clean closet. Question 13. Which side of the pillowcase should face the door? The open end. The closed end. It doesn't matter. The side with the tag. The closed end should face the door for a neater look and to reduce dust entry. Question 14. What is a mitered corner? A way to fold the top of the sheet. A neat, angled way to tuck sheets at the corners. A type of pillow. A tool for making beds. Mitered, or hospital, corners keep the sheets secure and tidy. Question 15. Should gloves be worn when making an occupied bed? Only if you feel like it? Yes, always, as you will likely touch soiled linens. No, never. Only if the client is awake. Gloves are part of standard precautions for handling linens. Question 16. What should you check for in the bed before removing the sheets? The client's slippers. Personal items like hearing aids, dentures, or jewelry. The client's snack. Dust bunnies. Always check for personal belongings that may have been lost in the bedding. Question 17. How do you move the client to the other side of the bed once one side is made? Tell them to jump. Roll them over the hump of the tucked linens. Lift them with a crane. Have them get out of bed. You roll them over the rolled up linens in the center of the bed. Question 18. True or false, you should lower the bed to its lowest position while making it to save your back. True. False. The bed should be raised to a comfortable working height to prevent HHA back strain. Question 19. What is the last thing you do after making the bed? Lower the bed to the lowest position and give the client the call light. Leave the room immediately. Turn off the lights. Take a break. Safety, low bed and call light, is the final step. Question 20. Why is it important to keep the client covered during the process? To keep them from seeing what you're doing. To maintain warmth and provide privacy/modesty. To hide the dirty sheets. To keep the room dark. Dignity and comfort are essential parts of HHA care.